Thanks, Leanne, and thanks, Carlo. I think what I want to do really briefly is add on what you've discussed from a point of view of a scientist practitioner who really worked with you guys and others on research, but at the same time interacting with patients. And I think one thing that I'm trying to think aloud with you today is the fact that these different discourses, like in societal discourses across the world, they have they are built from traditions, and tradition-built discourses. And I think there are some, and Robbie Dushinsky is doing it in great length in his book. There are different traditions in attachment research that build specific discourses that are not always clear for people who are just reading the online articles, both scientific and kind of the popular media. When you do science and you're practicing with patients, you're really walking this tightrope, as you mentioned before, Leanne. You don't want to lean too far into science and on one way, because there are so many intricate findings and it's not always intuitive. But you don't want to lose touch with it and completely lean onto the clinical practice and the popular media, because then you might lose touch with what science actually has to tell you altogether. And so in the next slide, what I want to show is that the paper, Leanne's paper, together with Robbie Dushinsky and that group, was one of the articles that that Dr. Christian Bernard and I commented on. And we asked the question, especially because of those discourses, clinically speaking, do all bad things go together? By bad things, we mean insecure attachment and psychopathology symptoms. And if this is the case, which is often talked about as if it is the case, especially in popular media, in social psychological discourse, and also in psychotherapy in some respects, if this is the case, then we must treat insecure attachment, or at the very least adjust it to resemble as much as possible secure attachment. This goes back a little bit about 20 minutes ago or so when Cara talked about sometimes how people talk about insecure attachment as a disastrous thing. And I think this is what we're trying to ask. Is it indeed a disastrous thing? But there is, this is just the beginning of the story, because once we start talking about this in the academia, it bleeds into popular media as good versus bad. And Leanne, you talked about that as well. I want to give you in the next slide a couple of additional examples to the ones that Leanne gave before. If you see on the top, and this is an example from Psychology Today, which has about 40 million monthly subscribers, which is way more than the most cited research in attachment ever, talking about why are some people non-compliant with stay-at-home orders. This was out just about when the COVID breakup hit here in the US. And the answer to that question was by that PhD, meaning a clinician herself, that writes popular media, was avoidant attachment would drive non-compliance. In other words, one type of insecurity at least may drive something that is not only bad for oneself, but also bad for society. So here we see kind of in full force how good versus bad is delineated and manifested in popular media. At the bottom, you can see another very popular online journal, Healthline, about 73 million monthly visitors, and a popular subject here that often talked about as a derivative of, not so much as a derivative of, social psychological science, how attachment plays into romantic relationships. And this author portrayed two types of insecure attachment, one disorganized and the other is avoidant, as characteristically flawed. The disorganized as erratic and unpredictable, and the avoidant as potentially have no feelings at all. So I think these examples kind of show sometimes why it is at least advisable to make sense of what kind of discourse are we talking about, what stands behind these claims. Leanne, if you can move us to the next slide. What I want to do, again, briefly, and for the sake of simplicity, is to talk about two types of insecure attachment. One is the deactivating attachment on the left side in blue, or a general tendency to exhibit decreased proximity-seeking behaviors at times of distress. And the other type On the right-hand side in orange, hyperactivating insecure attachment or a tendency to exhibit excessively increased proximity-seeking behaviors at times of distress. And both of these insecure types are thought of at the very least, and sometimes even shown to be associated with heightened vulnerability on the group level to mental health problems. But really, who shows that? And who talks about this such that we generally, especially in the lay population, believe that this is the case? Leanne, in the next slide, what I wanted to briefly show with you is two large-scale meta-analysis that we conducted in adolescents and adults, mostly young adults, comprised about 4,000 to 5,000 individuals over 55 samples. And this is a meta-analysis that assessed how developmentalists or developmental psychologists assess attachment. This is not across all discourses. This is a specific way to assess attachment through a semi-structured interview called the adult attachment interview. This will become important in a slide or two. But through this way of assessing attachment, we found that in fact, and again, this should be taken with a grain of salt. This is a correlational meta-analysis. Only those who are insecurely attached on the hyperactivating end, meaning only one type of insecure attachment, is significantly reporting more depression and anxiety symptoms compared to secure attachment. But the other type, the insecure deactivating attachment, does not show any difference whatsoever compared to securely attached individuals in terms of depression and anxiety. So within developmental science, we already see, and these are again our meta-analysis, that at least on the correlational level, basic science, not all bad things go together. And I should also note, and this is completely a claim that I'm making without necessarily relying on science or other way bigger and smarter people in the field than myself, developmental science of all the discourses, at the very least compared to the ones that I'm about to talk right now, has a little bit more sensitivity, perhaps also because of the data, to the interpersonal adaptive value of insecure attachment. We don't assess it here. We just see that potentially being deactivating does not necessarily mean bad, at least when it comes to depression and anxiety symptoms. In the next slide, I want to show a very elegant study that unfortunately was not conducted all that often. In 2008, Fortuna and Roisman did some cool things. What they did, they took 160 college students, and the very same students, they assessed them for attachment through the developmental tradition, through semi-structured interviews, or the AAI. These are the interviews that we assessed in our meta-analysis that I showed a couple of slides ago. And then the very same participants, they assessed with self-report measures that is very characteristic of the social psychological discourse. And what they found, and they assessed internalizing symptoms, which is mostly depression and anxiety symptoms. And what they found is that when you look at the insecure deactivation subtype of attachment, the more deactivating you are, the less depressed and anxious you report to be, which is in line with our meta-analysis. However, when you take the same participants and you assess them differently with self-reports, you see that the more deactivating you are, the more anxious and depressed you self-report to be. So really, we have here data that stand behind two different ways of assessing attachment, maybe developing two types of discourses. Leanne mentioned before a very popular book. I hear that all the time from patients. I read Attached. I know how bad insecure is. And Leanne also mentioned importantly that it is based on not only outdated research, but also research that is mostly relying on social psychological science. That is only the right-hand side of the numbers, not so much the left one. In the next slide, and I wanted to bring to your attention what Carlos' paper, the very same special issue, together with Marai Verhaag and Robbie Dushinsky, and they looked at meta-analysis and citation trends as maybe reflective of what's being more talked about in academia and potentially as a result in popular media. And they looked at 18 and under, 18 years of age and under, but when it comes to adolescents, they still capture what I am talking about in terms of different clinical data. They showed, among other things, that the interest, at least in the academia, at least in citation trends, the interest in psychological and social psychological science has been on the rise. So what sometimes people say, let's read science, they have higher probability of coming up with social psychological science of attachment, meaning all bad things go together. They have way less probability to come across a developmental science of attachment that actually shows that not all insecure attachments are bad. And in Lian, in your paper with Robbie also, and I quote, said interview-based attachment assessment, the one that we use in developmental science, has not been picked up by much popular attachment discourses. So again, we clearly see what's ruling kind of the discourse when we talk about psychopathology or symptomatology and insecure attachment. I don't think there is anything to say about who's right and who's wrong. I'm just saying we are indeed having some Babylonian confusion here. And I want to end by another very brief example in the next slide. This is a derivative of what I said before. Only the right-hand side is moving towards what people normally talked about, not so much the left-hand side of the data. The next slide is really talking about another aspect, really briefly, another example of what I'm trying to say here. This is going back to Carlo's paper that Carlo, you mentioned about 30 minutes ago. Attachment intervention, they work. And they work well. We know that from 25 randomized control trials. As you can see on the upper portion of the slide, child attachment security goes up, and that's good because we know longitudinally that that's going to confer increased probability of generally having better social skills and decreased symptomatology. But what we did not find, what you guys did not find in this meta-analysis, and maybe you'll speak to that more about it, is that pre-post intervention, actually, there was not a significant change in externalizing symptoms. In other words, security can be changed, and maybe it's important, potentially it's important, right? But externalizing symptoms are not. Now, to that, I want to add another thing in the next slides. Carlo also mentioned the study that we all collaborated on that looked at attachment to both parents. And so we created configurations of attachment security and insecurity. Here, for example, we talked about SS group or secure children, both with mothers and fathers, and compared it to other configuration groups such as secure mother, insecure father, and so forth. And what we found, multiple things, but two things that I want to highlight. Number one, if you're securely attached, if you're a child who's securely attached to both mothers and fathers, you have significantly higher probability to have less internalizing behavioral problems compared to the other three groups. Okay, what we did not find when you look at secure versus insecure is that it can predict externalizing behavioral problems. It's not predicted by secure and insecure attachment. So here we have converging evidence that not all bad things go together. And in the next slide, I just want to complete the picture. We did find one back, please, Lian. We did find that when you look at the disorganization versus non-disorganization, we can predict externalizing behavioral problem. Those who are disorganized with both parents tend to show increased probability to experience externalizing behavioral problems compared to the other three configuration groups. What does it say? Again, not all bad things go together. It depends, and you want to be careful about this. Which brings me to kind of the last, or I guess, intermittent conclusion in the next slide. In developmental science of attachment, not all bad things go together. We have meta-analysis, both interventions and basic science or correlational studies, meta-analytic results that show that not all bad things go together. It really depends on the type of insecurity. And what I think, generally speaking, we can say, and this is a very simplified assertion, but something to think about, in popular psychotherapy and social psychological discourses, especially non-academic ones, especially when it kind of trickles down to either clinicians that are not involved with academia or lay populations, for the most part, all bad things do go hand in hand. And that's indeed a Babylonian confusion, which I'm still struggling to try to, number one, organize, number two, relay, such that we have a unified conclusion to bring out to people who actually can use this data.